Hi, everyone. I'm Jamie Dorley, and I am live from World of Wellness, and we are celebrating the Wine of Wellness Week. This is the Winter Wonderland holiday party and sale, and it's hard to tell Winter Wonderland because we have special guest, Dr. Len Brancewitz, looking very comfortable down there in the Florida sun, isn't he, Joe?
Very comfortable. He always does. He had a support and a guy, nice little tan there. You got a
82
light
degrees.
shirt on.
82 degrees out right now, so we're doing okay.
All right, if you hear a bell ring, that means he's got to apply more suntan lotion, Joe. So he's on a tight schedule down there. I love how he's on retirement, but it's hard to tell. So welcome back to Godfather Joe Messino. I'm Jamie Dorley, and we got Dr. Len Brancewitz, who has been a colleague and close personal friend of mine and a leading pioneer, not only in Pittsburgh, then Atlanta, Peachtree City, and now he's in the Tarpon Springs area down in Florida. So, Len, welcome back to the World of Wellness and the Wellness Week. I mean, we've been doing events for over 20 years now, right?
Mm-hmm. Yeah.
So we know you're really busy. Thanks for coming on. Can you tell everyone a little bit about your background? I know you're a 1976 graduate of Duquesne University.
Yeah.
So, School of Pharmacy. And tell us a little bit, because you have one of the most unique backgrounds I've seen out there. When you combine
the thumbnail sketch, Jamie, is, as you know, graduated from the School of Pharmacy, went into pharmacy for a while, and worked my way up through a number of different chains. And it wasn't until I turned 39 years of age that I went in for my first real physical. You know, pharmacists, doctors, we stay away from doctors. So when I went in for my first physical, I found out that I had rather serious cardiovascular disease. And through a series of tests and difficulties, I was put on from taking no prescriptions to taking 6 prescriptions just overnight. And during that time, I developed seizure disorders from a couple of the different meds. That's where I started to study some of the side effects of the pharmaceuticals that I knew. And it was at that point that I decided to go back to school. I started out with the University of Chicago, going back for a degree in clinical nutrition. I got board certified there. Then I went back for a naturopathic degree, a different sort of naturopathic degree. There's a lot of really great schools that teach the ND degree. I went to New Mexico State for an NMD, which is more of a blend of traditional medicine and naturopathic together. And over the course of that time, I managed to put to rest my cardiovascular disease, put to rest my blood pressure issues, and I even had a beginning stages of an aneurysm on my abdominal aorta that has since gone away. So it's been a work in progress, and I'm continually doing this. And then the only bleep in the whole system was exactly 10 years ago, kidney cancer. And again, when you go into something at stage 4 out of 5, and the risk factors of losing a kidney or going through chemo or radiation, I managed, through the help of a number of good surgeon friends, to still have my kidneys, never did any chemo, no radiation, and I'm here saying that I'm cancer-free for 10 years. So it's been a work.
Congratulations, Len. I know that was a really tough time for you. I remember you were doing a half marathon down in Pittsburgh, and you were having a lot of cramping issues.
Right.
And I remember we talked right after, and you knew something was going on. I was glad that you attacked it like you always do, went right after it, didn't waste any time. He made some really tough decisions, and here he is 10 years later. And we appreciate all the support, not only the World of Wellness, but Nutritional Frontiers. You're one of our original clients, especially with things like GI Complete.
Oh, yeah.
So can you talk a little bit more about what's going on right now? Because we're getting bombarded with questions, right? I'm seeing autoimmune conditions on the rise. The shot or no shot, what are you seeing going on? Because people need to take the responsibility back. I look at the COVID as a blessing. This is like the modern day flood, right? To kind of clean up what was going on out there. Now people are sitting there saying, what else can I do about my health? And I think it was good that we did hear a little bit about, C and D and zinc and those type of things. But what type of questions and what types of clients are you dealing with? Because, I think there's 2 schools of thought. One is people are really scared, and others are starting to take responsibility back for their health.
That is absolutely a phenomenal question, Jamie. It even got to be a point of frustration with myself. And I'll just start out with this. I came up with a basic 4-pronged approach using N-acetylcysteine, probiotics, buffered vitamin C, and then adding in SPMs. And when
I love it.
you first brought in SPMs, it was like I heard the Hallelujah choir going off because I had been reading about them. And I guess this is my word to the wise. Whether you have been vaccinated or not, whether you are an anti-vaxxer or not, whether you had it or not, over the last 4 weeks, I've probably had 7 patients, 6 of which were in the Pittsburgh area, that already had COVID, that came down with it again, a second tier. And in discussions with them, I said, well, did you keep up with the protocol? Well, yeah, I went to Walgreens and I got that vitamin C you talked about. And I said, no offense to Walgreens, but did you not hear me say over and over and over again, buffered forms of vitamin C? It comes in a capsule, it comes in a powder, it comes in a liquid. It's one form that is going to support your immune system. You can't alter there. Did you stay with it? Well, no. Well, is that the sole reason you came down with it again? Well, maybe, but let's get back on the stick. So my word to the wise is, first of all, this thing is going to be around now probably forever. COVID's with us, just like the flu shot every year. You're going to see a new version of that. And until Fauci gets fired, I mean, we will get the scare tactics coming from above, and it'll just blow you away. Even though the guy that calls himself the president keeps trying to force everybody to get vaccinated, and now he's been stopped by virtually every court, you've got to do something. Yeah. You've got to take self-control. And that to me, and I let me just give one more little plug here for SPMs, and I'm going to let you all chime in on this one as well. But when you look at the catastrophe of coming down with COVID, the cough, the sinuses, the achiness, the breathing issues, all the above, what's causing all of those? What did COVID do different than the traditional? It was a cytokine storm. It just made this massive amount of inflammation that flooded the body and overwhelmed it. I'm looking at an article right here that I've been carrying with me since February of 21. Frontiers of Immunology. Specialized pro-resolving mediators as regulators of the inflammatory macrophage response of COVID-19. This article is like 40 pages long. It went into rhyme and reason how SPMs can become not only as a preventative, but as this is a word we have to watch every now and then, as a treatment. That if I'm starting to come down with some of the symptoms, you start ramping up SPMs, 2 a day, 3 a day, maybe 4 a day. Reduce the inflammatory things that are happening in the body. Make sure we don't get any clinical side effects from the COVID, and you can respond to it. You can build up antibodies and move on, but you must take accounting. And I'm telling everybody that I talk to, have a bottle of SPMs in the medicine cabinet somewhere, even if you're just taking 1 a day. Give it to your
That's a great point, Len, because I tell people you want to make sure you have these in your wellness cabinet or medicine cabinet. You want to make sure you have them in your system and that they are handy, because usually what happens, people wait a few days and it's already got deep inside their tissue. It's almost too late, or it's a lot harder now to have that get out of the body. So one a day. And then what about a therapeutic dose? Because I found for me,
you have to go to at least 2 a day. I personally tell people to go higher. You can always back down. Yeah. I will go 1 with each meal, breakfast, lunch, and dinner. And I will do that 3 times a day and stick with that until the inflammation and the body aches and everything else go down. It's one of the most
I really noticed a big difference when I do 3 once or twice a day. And Joe's got some personal experience. What about yourself?
I mean, it's incredible. It's my new favorite nutrient, Len. I had not used it prior to us, bringing it out a couple
Get
of
a
months
chance
ago.
to show the SPMs.
And I started using it just because I was having issues with joints. It wasn't a COVID thing. It was joints, and primarily my hands and my thumbs. And so I was getting chiropractic, I was getting laser treatment, everything. Nothing seemed to be working until I tried the SPM. And then it was like a week or so after I started taking it, all of a sudden I just woke up one day and realized I could bend my thumbs at my knuckles without any restriction. It just, over a few days it took hold. And then other positive side effects are just joint related, wear and tear seems to get relief from this because it gets so deep into that systemic inflammatory, process. So I think it's a great nutrient. I'm not going to stop taking it.
So Len, can you summarize a little bit of the research and why this is so important and how the mechanism of action may be a lot different than what people are used to?
Yeah, everybody says, oh, all that is some supercharged fish oil. Well, in a way, sort of kind of that way. But if I would say this, where it got its basic beginnings was the fact that in the early stages of COVID, when people would develop the potential blood clots, leg blood clots, it was, we know a number of people that developed, some dear friends that have developed blood clots. Well, they found that those that were on a high dose of aspirin, along with fish oil simultaneously, there was this reaction that took place in the body that supercharged the effect. So when they looked at that and they said, if you looked at the chemical structure of this and you went into a lab, you went in and altered this chemical structure to make it more, how do I say this, more of a Pac-Man type effect, that as this circulates around in the body, it was able to, you want to use the analogy of Pac-Man, hold up and activate macrophages to go out and defend us, but at the same time suck up these cytokines that are being produced, so we didn't have this inflammation going to your eyes, to your sinuses, to your lungs in particular. So, and I just wanted to bring up another point, and I just pulled this one up. Back in December of 20, Journal of the American Medical Association, Journal of Pediatrics, treatment of severe acute respiratory syndrome and COVID-2 infections in children and adolescents being treated in hospitals with SPMs.
Wow.
It's published in JAMA in pediatrics, because I know there's a lot of people out there right now saying, well, I can't give this to my kids, can I?
Yes, why not?
Why not?
Yes,
well, that's where they get it in the first place, right? I mean, it is endogenous to the body. It's not a high charged fish oil, because the very first place you get it is from mother's milk. Is that not right? Is that correct, Len?
Yeah. Exactly right. Exactly right. And, just as you said, Joe, not only is this in the world of COVID, but in all inflammatory events.
Yes.
Now, I'm taking it primarily because the potential for me to have an abdominal aneurysm, that my father died of at age 51, very early. I had the starts of this early on. Now, I've been using a lot of high-dose fish oil for a long time, but then when the SPMs came, I put that into place. Now, let me just say two things, and I have nothing to base this on except me, just me. When I left Atlanta August of last year, right before I left, I went to my eye surgeon. And at that point, he said, when you came to us moving down from Cranberry, and your doctor, Dr. Christie, a well-known friend of mine, leading optometrist, eye surgeon in the Cranberry area, told me that I had macular degeneration and the starts of cataracts. So when I came down here a year later, he says, yep, it's the cataract thing. Well, I started an SPM's buddy, roughly a year ago. And I just went in this past Monday to see my eye surgeon, my yearly checkup. And I said, you do your thing, you do your thing, you do your thing. And at the very end, he says, well, you're good to go. We'll see you in a year. And I said, well, wait a minute. I thought we were going to schedule my cataract surgery now. He looked again, he pulled up the paperwork again, and he said, I don't think so. Now, is that, I'm going to put God's hand over this as well, but you reduce inflammation, and you know that even something like a cataract, which they say is almost obvious as you get older, it's an inflammatory process of the lens. It's an inflammatory process, the rusting of the lens and the outer surface of the eyeball. Could this, and there's been no trials done on this, but I'm just living proof that I don't have to have cataract surgery now. I don't
need no stinking
There's
trials.
a lot of
Come on, this is the evidence that is important, Len. Actual anecdotal evidence.
It's just amazing to me. And the fact that when you have issues like that, eye issues, or how about individuals with breathing issues? That I can't tell you how many people you run into that are on inhalers now. And by the way, from my pharmacy perspective, I used to sell albuterol inhalers in my medicine shop for $9.95. They are now $300 in that short period of time. Something as a simple albuterol inhaler. So there's a lot of people out there struggling just to keep their breathing open. Could this literally solve the inflammation in the lungs and basically help you? We're not making claims here, but could this literally help you to breathe better and keep the body under control from that perspective?
That's a whole paradigm shift from when the approach of NSAIDs, right? Or some of these other anti-inflammatory over-the-counter medications. And there's a couple questions here. The one gentleman is saying, I have terrible knees from playing basketball my whole life. This looks like it can work for me. My knees hurt so bad I can't sleep sometimes at night. Absolutely. Talk about the ability, Len, for it to clean up the debris in there. Now, when you add something like HA+, you can actually rebuild the joint. But if they're too hot, you're not going to be able to do it. That's why we always use a combination of those two, either X-Flame or SPMs, with something like HA+. What's your thoughts on that?
Using the SPMs, but I think that's a critical point, Jamie, is that oftentimes when somebody hears us talk about this, they'll go out and buy the SPMs, but do nothing else. And as you said, it's, you look at it from a knee perspective. I've got to lower the inflammation, so the SPMs come in and start that process. I've got to start to rebuild that joint space, so the HA+ gets in there and starts rebuilding the joint space. And I need some temporary relief. So I go and I want you to talk about topical CBD, because there's a boatload of them out there. You can find it in any gas station. But when you use a pharmaceutical base to get that through the skin in the form that you all have, it's a three-pronged approach that can give you relief so that you can sleep overnight, and knowing that you're starting to rebuild that joint space. It's powerful.
Len, you obviously used Lipoderm in compounding hormones over your career, right? So give us some firsthand information on that. That's what we use in this cream, is Lipoderm, to get it through the skin, transdermal. But you've got experience with that more than anybody we've probably ever had on here.
Well, and being a compounding pharmacist, when I would do hormonal therapy for a patient, they're doing some estrogen, some progesterones. You needed to get it through the skin. Okay, so we needed to get it through the skin. Now, the skin has this, every place in your body has this, what they call an acid mantle, which means it's going to resist having things go through. Because if our skin was wide open all the time, if you spilled coffee on your hand, you'd absorb coffee into your system. There's a barrier there. Okay, so all of those micro pores need to have the capability of opening up. If you're going to apply something that you want to get through the skin, you've got to get it transposed through the skin, open up the pores, get it in, and carry it into the circulatory system. Okay, liposomal bases. And I'll never forget this. When I started to do the compounding, I would call the compounding centers to order my raw materials, and I could order just a plain, what they call a transdermal base, which was virtually Vaseline with some water in it, or I could get the liposomal, which means I am going to have this opened up
and maybe the CBD
and transported through the skin. It was 10 times more expensive. I mean, literally, if it cost me $1 for a prescription on this inexpensive stuff, it cost me $10 on a prescription for this liposomal base. It is more expensive. But if you're going to use CBD and you want to get it into that joint space, into that spot, get it absorbed systemically, you need to have the right transportation through the skin into the body and let the body absorb it and utilize it. So in that condition with that fella, you can say, well, that CBD is rather expensive. Yeah, it is. But you know what? It's going to give you the relief. And I tell people when they use this full spectrum hemp extract, the size of a dime, you don't need a bunch. Just do it circularly. Just pump it out. You have a metered dose, put it in there, let it spread out, and with that liposomal base, it'll spread out through that entire joint space. So go on the tip of the knee, circulate it around, and it will spread throughout the entire knee space. So you don't have to slather it on. You can use minimal amounts and get good, solid relief with it. That's a great point.
Yeah, that's one of the interesting points about the whole CBD market when they say it's expensive. Well, compared to what? If it doesn't have lipoderm in it, and it's in an Noxzema container with some menthol that you're going to feel topically with a really low dosage CBD, or one that's from Mexico or China.
It could even be a high dose. It's not going to get through the skin.
No. And oftentimes I look at this, I say, it's not what you put in there, it's what actually gets into the cell and cools it down. And we've had hundreds, if not thousands, of people come back and report the incredible results.
Sure, and we've done it right here on the spot in the wellness center during the events, and they're getting relief within minutes.
We had a young lady last week. I've been telling everyone, Dr. Perlmutter, of course, his old office in Naples. I was down there with Natalie, and the young lady, Vonnie, at the front desk said, I said, I have some samples. You want to try them? She said, what do you got? I said, do you have any digestion, pain, stress? So she said, yes, all of them. So I gave her the CBD cream, and she had a little bit of tension headache. They were real busy after the holiday. So I had to rub it right here on the temples. And what I learned from Mike Gallagher is anytime with that, you should put it in the pressure point behind the ear too.
Right.
Mm-hmm. So we did that. She says, I can feel relief in a few minutes. And then later on, she came running into our training, and her thumb that she couldn't do this with, she was doing this. And they said, what did you do? And she says, I use their cream. I don't know what's in that stuff, but you get quick and fast results, 5 minutes or less. The only caveat is you got to rub that in, like you said, about 2 to 3 minutes to make sure that mechanism of action really works well. But I've not had anybody say it didn't work. Have you?
No.
Not one.
Not one. We haven't had any. It does work. It's worked on many different applications, joints, tension, muscle, soft tissue, the works. And not only that, Mike's got quite a few practitioners that have had topical relief from it, from abrasions as well.
Poison ivy, blemishes, cuts, scrapes, acne, all types of different things. I know my first personal experience was when my wife was doing a lot of furniture work, really tense at night. So after a 15-hour day, I'd have to give her a massage at night, Joe. So
wait, she had a 15-hour day, or you did?
No, I did.
Oh, okay.
Yeah. So I started putting it on her neck and stuff, and then I got done. I would just rub it into my hands, and after a day or two, I was like, I didn't even know my hands were stiff.
Oh,
right, from all the working out and work over
there.
Exactly. So I was shocked. I said, no wonder you like this stuff so much, And my dad, who's 82, he's had a bad knee since a kid. He got his knee crushed as a kid, but great shape. He still golfs and bowls and cuts his grass and everything in the early 80s. And I said, does that work, Pop? I don't know if that stuff is working. He calls me. He says, I'm out. I says, oh, what's that mean? He goes, just send it. Just send it. So he puts it on his knee every day, and he says that helps him get through the bowling, golfing 3 days a week, and he's still really active. But he says, because he won't do the knee replacement, he says, for what at this point? But he uses the transdermal cream. He uses HA+, and then he does use our omegas, right, which still have an anti-inflammatory benefit. So that Lipoderm, one of our top formulations.
Oh, yeah.
I carry it in my golf bag, and I'll tell you this story real quick. Went to play golf.
Well, hold on. If you're using it for golfing, Len, you must use a lot of it. This guy's golfing every day now.
I wish I could. But anyway, I was out golfing yesterday, and everybody in the world was out. So they ended up clicking us up with another twosome. So we went up to play. We're on the first hole. We're ready to drive, and the fellow noticed I was carrying a little Steeler container where I carry my golf balls, Pittsburgh Steelers golf balls. And he says, "Oh, you're from Pittsburgh." And I said, "Yeah." He says, "So am I." "Really?" "Yeah." I said, "What part?" He says, "Born and raised in Mount Lebanon for 50 years."
Oh.
And he went on and on. And, there's another part to the story, but as he was 2 years older than me and we're out playing golf, and about the 11th hole, he started to really fatigue out. And I said, "Something wrong?" He says, "It's my back." He says, "I got this bad back and nothing will help." And I said, "Time out." In the middle of the 11th fairway, I had him take up his shirt on his back, and I'm applying CBD topically to the base of his spine, up and down his back. "Put your shirt down. Don't hit the ball anymore until we get up to the green." He gets up there. He played like crazy. Hole 12 through 18. He says,
Oh, man.
"What was in that stuff?" So literally, he sent me a text message this morning. He said, "That stuff was like amazing." He said, "It saved my game." So yeah, it's fabulous.
It's got a good idea for some new packaging for golfers, huh?
Yeah.
Yeah, we happen to have our new chiropractor up here who is TPI certified, Titleist Performance Institute. And so he's worked with a lot of golfers. So I think we got something cooking here.
Len, if you wouldn't mind maybe going on the golf tour with us to provide all the research and application for these things, right?
There you go.
No, I mean, that's an important thing because that's a quality of life, right? People are out there golfing. And what do they normally take? What, NSAIDs or prescription pain relievers?
They live on ibuprofen. They live on ibuprofen. I mean, they all carry a bottle of Advil in their bag. They just pump those things out, and then they complain their stomach hurts.
Yep.
See me. You're going to see me eventually, and we're going to do the GI Complete eventually. Just keep taking those ibuprofen. Hey, can I change?
We can't let you go without you talking about GI Complete, Len. We can't let you go because I can't tell you.
Say that. I'm going to save the best for the last.
Okay. Yeah. Because I can't tell you.
Here's my question for you, the two of you.
Okay.
Put your heads together on this one. First of all, as of December 7th, in the United States, one person dies of cardiovascular disease in the United States every 36 seconds. Humbling. Highest in the world. In the rest of the world, it's one person every 12 minutes. We're 36 seconds compared to the rest of the world. Now, this article that I brought out this morning said, give me the name of a food that you could add to your diet that could control and help to manage your high blood pressure. So I'm just going to ask you, especially the Italian guy there, what food do you think would top the list as far as helping with high blood pressure? And this is going to go.
I would say garlic, but go ahead, Joe.
Garlic's good.
Garlic's good, but I'm going to go with either tomatoes or I'm going to have a two-pronged answer.
Oh,
here.
he's just
Organic grapes.
There you go. They're all good. Don't get me wrong. Right. The tomatoes really was good. Tomatoes, garlic together are really
greens.
Good. This article said out of all the foods, if you added a daily dose of yogurt to your diet, 1 cup of yogurt a day can lower your blood pressure down anywhere from 12 to 20%. Okay? Now, that's one thing to say. We're not here promoting yogurt. But I went into this article itself, came out of the University of Maine, and it says the probiotics that come out of yogurt have a chemical reaction that takes place in the gut of most people that convert various proteins into substances that can cause vasodilation and lower your blood pressure.
Interesting.
So the article came out and said, you know what? One of the foundations of blood pressure control should be probiotics, A, the right form, and B, the high enough dose. So I'm starting now, and I'm going to start this because I've been using CardioStack and CircuCore as my foundation for blood pressure control and cardiovascular disease. I've always had, so they'll take 1 probiotic a day. I'm going to 2, 3, maybe as more as 4 or 5 probiotics a day, at least initially, that start settling in the gut to start growing enough good bacteria so that we can then see the effect in your blood pressure. Again, not making claims, but we're now saying that the right forms of probiotics and nutritional frontiers, you got a number of really, really good ones that can manage and control blood pressure.
Yeah, that's a great point, Len. You know, when you look at the nutritional frontiers, NF for life, great pyramid of health, right? Our pyramid, after we look at the foundations, your lifestyle, the first thing we look at is prebiotic, probiotic, and enzymes. Because if you're not absorbing, you're not assimilating, excreting, nothing else matters. And the old naturopath saying, I know you've followed this philosophy for years, is, you know, health and death begins in the colon.
Yes.
And what about the connection with what's going on with COVID or the vaccine and autoimmune conditions, right? All stemming from the intestinal tract.
The integrity of the intestinal tract, right?
And that's another really good point. And attached to this article, talked about research showed how that simple add-on to the diet can also, as a secondary effect, alter your immune system function by again increasing the gut microbes. So it talks about going in and reducing inflammation in the gut using something like GI Complete. And again, the point I want to make here is, I understand you get the container as 30 doses. Obviously, that's 1 dose a day for 30 days. Yeah, as a foundation, yes. When I have somebody that, and this is again, most individuals, I'm taking the GI Complete up to at least 2 doses a day. Once in the morning, once in the evening, away from food, get it down there, get it into the system, let it do its job. It's not going to be the first day or the second day, but by the 3rd or 4th day, you're going to feel substantial changes in your gut health. Bowel function will be better. Urination will be better. And in this case, at the end of 30 days of doing that, your immune system is going to be so active so that if you're concerned, you're traveling, you're going to be on a plane. I recommend strongly GI Complete as a dose twice a day or even 3 times a day, the day before you step onto that plane. Get the gut healthy as anything to help your immune system fend off what you may be exposed to on a plane ride, a car ride, or family deals going into Christmas. You know, dear old Fauci wants you to wear a mask and stay socially distanced. How can you have manicotti when you have a mask on? You can't do that. You know, so, you know, if there's a concern there, if you're concerned, you don't know the status of the rest of your family, take some GI Complete. Upregulate your immune system that way in a myriad of different ways that can actually help to keep your immune system strong and keep your digestion as a foundation getting better and better into the holidays.
These are fantastic points. I love all the connection with the immune system, the probiotic, and the GI Complete. Let's talk a little bit about the foods, right? Because this is a lifestyle program. I think oftentimes people may look at the supplement as a green medicine. I'll take this instead of the medicine, right? Inevitably, we know you can't out supplement or even out medicate a bad lifestyle
or bad diet.
The lifestyle, right?
Yeah.
So when people are choosing the food that feeds the bad bugs, which are sugar, dairy products, right? Excess alcohol. I think that's really what the cause of a lot of this is. And you factor in antibiotics or the antibiotics in the food, right?
And the proteins, right?
Particularly the dairy and the meat, right? So when you look at those things, I think we got to have a shift occur with people to realize, look, I need to starve the bad bacteria, kill them with Candid Kill, and then repopulate with GI Complete and probiotics. What's your thought on that, Len, with the diet and Candid Kill?
Well, that's a fit. I was going to go there next. You're reading my mind, Jamie, because
great minds think alike, Len. That's okay.
You know, and I'm even thinking to your days back, you know, back with Metagenics way in the past, how we utilized the anti-inflammatory diet. I still use it to this day. It's been a gold standard. You know, it does eliminate a lot of those different foods, but again, in probably 80 to 85% of the cases, there's more bad stuff growing than there is good. So if you want to get this job accomplished efficiently, you got to go in and clean house. You got to go in first to clean out the bad. Candid Kill does an amazing job of that. It's not just Candida. It's going to take care of what they call firmicutes, which is a lot of the inflammatory bacteria that tends to overwhelm the Bacteroides. These sound like two Italians, I know. Bacteroides, the good-sided bacteria. So if you eliminate the Firmicutes, the Bacteroides start to go up, and then you come in with GI Complete and Calm and have that mucus lining re-enhanced, have the tissue enhanced. Then you can come in with the probiotics to seal the deal. So it makes such perfectly good sense to do it stepwise. Do it and follow instructions and get the job done correctly.
And there's always going to be good and bad bacteria in the gut, right? It's winning the colonization war that's going on between the two. You can never completely get rid of the bad, but many times we get rid of the good.
Yeah, it's like a neighborhood, right? We all remember the neighborhood we grew up in, and we move out and it goes bad, but we can handle one bad neighbor.
Yeah.
You can't handle more than a couple. And that's what happens in the gut ecology. And we're actually doing a big event, Len, in January with Elizabeth Tringali. She's a physician assistant and board certified functional. And she's going to be doing that on the power of the microbiome, leading right to me and you talking about the top 5 case studies, which I know GI and autoimmune will be number 1, right?
Absolutely. Absolutely.
Yeah. Well, I can't tell you how many doctors that I've said to I mentioned your name and said, we have, Dr. Len Brancewitz, that his foundation formula for every single patient he sees is GI Complete.
Exactly.
Period.
Exactly. And it always will be, because things just aren't going to change overnight. This is the nature of the beast. Go into any drugstore now and just go into the antacid out and just see how many people are popping Prilosec OTC and Nexium and all these different, the sections are huge there. They're saying that about, I think, 80% of hospital discharges, whether you go in for a scrape or a bruise or whatever, you're discharged with a script for Nexium. Why? Well, because they can. They give it to you, they start suppressing the stomach acid, and the whole GI system goes down the drain. So it's a battle we will continue to have, and understanding that most gastroenterologists have a hard time buying into this concept, that you can actually heal the gut without actually having to use a steroid. That standard of care using steroids are what most gastroenterologists do. GI Complete does not use steroids. It uses natural calming entities to go in and calm the gut, reduce the inflammation, but not only that, but start that healing process going, which is critical.
Yeah, you brought up some great points, Len. We had some people come in the last couple of days and, they're on antacids. And I'm trying to explain that the difference. One is, I told the gentleman yesterday, I says, you need to have a physical maneuver done, the hiatal hernia adjustment.
Yes.
Know what he said? He goes, oh, that's 2 days in a row. Someone's told me that. I said, well, how many days in a row will it take before you realize God's telling you need to get this hiatal hernia adjustment? And can you go a little more detail about this whole philosophy of too much acid versus not enough acid, the acid's in the wrong place? Because some of these medications you mentioned used to be prescription, right? Like omeprazole. Now it's over the counter. If you read the box, it says do not take for more than 14 days. Meanwhile, people are on that for months or years.
Well, in understanding, the basic core of the way God created our bodies for digestion, you have your pancreas, which is producing the enzymes that help you to digest fats. Okay. You've got the liver pumping in and producing bile through your gallbladder, helps you digest most proteins. And then you've got this hydrochloric acid pumps that line the stomach that just pump in hydrochloric acid into the stomach to keep the pH of the stomach at about 1.8, which is extremely acidic. Not too acidic to burn a hole, but just enough to digest our food so that we can get the food into there, digest it in a period of just 5 to 18 minutes, let it fully digest, and then empty out into the colon so we can start to absorb it. The problem is when you go in and assume that it's excess acid, and there are a lot of cases where it is, and I can't downplay the role that some people do get reflux so badly that they need to do something like that temporarily at least. But The idea of staying off of that after 3 or 4 weeks, and please, if you're on it right now, don't stop. You need to talk to a healthcare practitioner to help you down yourself off of that, or you will have a tremendous rebound coming off of that. When you suppress stomach acid, that puts the full strain on the gallbladder and the pancreas to do the digestion. And you will never get the digestion time down to that 18 minutes, which is the maximum time it's going to stay in your tummy. If we suppress stomach acid, food will stay in the stomach 20 minutes, 25 minutes, 30 minutes, and you get that distension and that feeling of fullness continually because it's just staying there. Then I get gas and bloating and it just feeling so uncomfortable. And then, that eventually rolls into constipation and or diarrhea. So it's a matter of being on those if you have to for the shortest period of time. Utilizing a prep like Probezymes, which, they're another godsend where you can actually use a chewable probiotic digestive enzyme combination. And I usually combine those with Cybezymes. I'll use the Cybezymes before meals, use the Probezymes after meals for serious conditions, and then use the Probezymes also for any breakthrough. Because one of the things that we've noticed now is a lot of people with breathing issues that are on Nexium or omeprazole over a period of time. And the reason is, as that food stays in your stomach longer than 18 minutes, it starts to off-gas CO2. Carbon dioxide, it's part of the digestion process. And instead of passing down into the colon, it's coming up the esophagus and you start to inhale it. So it will cause a mucus buildup in the back of the throat, cause irritation, you start to cough, and then you start having wheezing issues because you're displacing some of the oxygen that goes over. So it's not a harmless entity. That's why they say limited to a maximum of 3 weeks, most times only 14 days. That's usually enough to find out if it's going to work, and then shift into some other protocol to support it so that you can heal the gut rather than have to worry about that for the rest of your life.
Those are great points, Len. I think sometimes people think it's an either or, right? And even people in the natural field do that, allopathic field do that. But I like how you bring the uniqueness of the combination and the transition, right? Because if they do go cold turkey off one of these, they may be suffering. But things like Probezyme and then the dietary adjustments and Cybezyme can make this realistic, and the transition is a lot smoother. Because Probezyme, a lot of people call that a natural Nexium or Prilosec or Prevacid. We're not making any claims, of course, but some people do utilize that, our healthcare professionals like yourself, to transition these people.
Yeah, absolutely. It should be used as a transition. It should be used then ongoing. Okay, just as you said, and we've always said, you're going to indulge a little bit, have that Probezyme with you. Make sure you have it. Use it prophylactically, use it therapeutically. I tell so many people to use it before bed because that's when they get a lot of those issues with the reflux.
I think a lot of it goes back to
carry them in your car. I have a small bottle in my car. My wife has it in her car. You never know when that's going to hit you if you just happen to eat wrong, and you
not
need
only is it a great product, Len, but sample sizes that you can put in your car like that.
Yeah, exactly.
Thanks to the architect over here.
Yeah, and they're very safe for children to have. Moms that are breastfeeding, right, can do them. You can crush it up for an infant.
Sure can.
Real safe for adults of any age or children. These are dairy-free, gluten-free, and vegetarian. It's a probiotic and a vegetarian enzyme blend, so very therapeutic. I like to use them acutely too. I take them in between meals. I think they help me a lot, just maybe some undigested proteins. But the big thing is I think people got to get away from the processed food because it's not going to break down regardless, right?
Right.
We see these examples of things like Big Macs sitting around for 10 plus years. They don't break down. The other thing is around the holidays, when you're going to partake in a more volume of food, I actually take 2 or 3 before the meal because I want to get those enzymes cooking. What's your thoughts on that?
You know what I do, Jamie? What you do at every one of the events is lay out a sample bowl. I'm not putting out mints. I'm not putting out peppermint mints for the people. I put out a bowl of Probezymes that if you're there, well, what's that? Just chew one. Okay, what was that? And I said, if you have any kind of digestive problems, having one of those before you sit down for that big dinner, great idea. and if you
It's,
need it
yeah,
afterwards, they're right there in the bowl. So
it's funny you mention that. We were passing around before Thanksgiving,
Mhm.
right, Kylie? A little Probzyme. We're eating a little extra food. So, yeah, it really helps out a lot. And it's something that's so easy to use.
Oh,
And
yeah.
it tastes good, too.
Tastes great. 3 different flavors. Talk a little bit about the Bacillus coagulans in there.
well,
And
you want to talk about this? That comes out of soil research. If you
yes,
really
soil
look
based.
at, and I'll go back. I was raised by my Italian grandfather, who came over from Trieste in the northern part of Italy, and he used to take me out into the garden. I don't think he really knew my name. He called me boy. He'd say, "Hey, boy," and he would go out his tomato plants, and he would literally go down into the ground and taste the soil. He knew whether it needed some extra fertilizer, some lime, whatever. But he always taught me about the attributes of a compost pile. At the end of the season, you put it all over there. Let it just age and form bacteria. And he said, that bacteria, I want to get that into my tomatoes next year. And he would have these fabulous tomatoes. Now, you talk about, my friend Pete, Farmer Pete down the road from your home.
Pete Karras Farm Market. Give him a plug.
He actually uses that form of probiotics. So they're now saying that these soil-derived probiotics, rather than dairy-based, actually are easier on the human body because they are spore forming. So the intriguing thing is when you take them in with something like Probzymes, they can start to propagate your esophagus, and they will start to form and make their home there and give off these small spores, so that every time you eat something, the food is going to pull some of those spores down into the colon. What a great way to get it down into the colon, so you start growing good stuff. So just a tremendous source. I know it sounds a little strange, soil derived, but it really is phenomenal on how they match the human strains of probiotics better than anything we got from dairy.
I think it makes sense, Len, because we always ate out of the soil. That should be where our baseline probiotic comes from.
Yeah, we were talking about that yesterday with somebody that said, people's joints are so worn out these days, because in the old days, when I grew up, my mom and my aunts and stuff, they would cook chicken, but then they would use the bones for soup. You get all these different nutrients, the cartilage and, all the growth factors in those things that people normally ate. And now I think the biggest issue is the processed food and the ecology of the gut. It goes hand in hand. So we're going to continue to talk about the end of this year and next year, all the issues with toxicity, and the big thing is nutrient depletion. And it's really created a perfect storm. Now you factor in a pandemic, right? And you factor in a vaccine and all these things going on. It is a perfect storm for toxicity and nutrient depletion, especially in the gut. So things like Probzyme, GI Complete, Cybezyme, these are foundational, folks. These are not things you're going to find on Amazon. They're not available through the GNC. These are only available through a healthcare professional like Dr. Len or World of Wellness.
That's right. And
do you have time to bring up one more big point?
Yes, Len. And for now, we do a little drum roll for you.
Just into the end, and for decades, people have been saying, why do people gain weight? Why is it at the end of this pandemic, everybody put on an extra 10 to 12 pounds? You ate too much, or it's my thyroid, or I have digestive problems, or it's never my fault. It's nothing I did. University of California, Irvine, back in August, finished a 12-year study looking at the reasons for obesity. Reasons for obesity. Scientists have discovered the most novel approach to attenuate diet-induced obesity. And they said, what you need to do is attenuate mitochondrial dysfunction. That when the mitochondria, these little power engines inside of every cell in your body, cannot produce enough energy, the body goes into a storage mode. So even those that say, I'm only eating 1,000 calories a day, but I'm still gaining weight, typically this gets to be one of those issues. So I have been for the last, and I'm going to do a big push through my people again in January. We're going to call it a new you in 22. And we're going to do, again, a 90-day protocol of enhancing mitochondrial energy, boosting mitochondrial energy by using what I am now giving to virtually everybody, which is Power Cleanse. That prep has just revolutionized things for me. Not only is the taste good, I personally like the pineapple myself, but what it does to the energy stores in the body over the course of 30, 60, or 90 days to re-enhance your energy levels. I then layer in Power Fuel, getting in the D-ribose into the system, and the CoQ10. And you're going to say, well, what's this have to do with weight? It increases the metabolic energy and the burn in the human body so that as we cut down in the pure amounts of food that we're consuming, the body actually can go into a burn mode where we can actually pull visceral fat out and start to lose weight and see the energy, see the difference in my body, see a couple inches come off my midsection. So again, everybody's going to be going and making that obesity thing, and I want to get my weight down in January. Power Cleanse, Power Fuel, CoQ10 as a foundational start. And then I'm using as my second tier, somewhere in that 90-day period of time, the ketones, the red ketones, and the CLA. So the tonaling
I love it.
made a big, big difference. And people like that prep and continually stay with that one as they go through.
Great minds think alike once again, because our focus on January and February is clean and lean.
Mm-hmm.
We're adding in the Power Cleanse, the greens, the Power Fuel, and then transitioning to the berry tone, the CLA. So right on target once again. So thanks so much, Dr. Len. We really appreciate you making time and taking an hour away from the golf course. You've got some incredible research and background, and we love working with you. Thanks for all the support over the years. We're really excited for those events coming up in January and February, which you will be a speaker at the one in February in Tampa.
Awesome.
So
Great.
Thanks so much. Thanks, Joe. Thanks, Philly.
Bless
Phil,
you guys.
have a great
Have a
day.
great, healthy day.
Yeah, God bless.
Bon Natale.
Bon Natale.